Good afternoon. This is George Zinn, and thank you so much for listening in this afternoon. We have a nice program lined up for you here this afternoon that's going to be talking about probably one of the most talked about topics anywhere in the country right now, and that's dealing with COVID-19. And we have a nice panel that's gathered here with us, and we're going to help try to share a little bit of information pertaining to this COVID vaccine. I'm going to bring forth at this time Mrs. Marketia Morrow, who just happened to be the chief nursing official at the Alliance Healthcare. And at this time, I'm going to let Mrs. Marketia have a word, if she would, at this time.
Oh, good evening. Good evening. Yes, I am Marketia Morrow, Chief Nursing Officer for Alliance Healthcare System here in Holly Springs, Mississippi. And we are definitely here to serve our community. Thank you to Mr. Zinn for inviting us here, because we definitely want to make sure that our community is informed when it comes down to this COVID vaccine.
Okay, thank you so much. Then I'm going to bring up the star of the show, and we're going to, and this young man, he's not Mr., but Dr. Kenneth Williams. He's the owner of Alliance Healthcare and Williams Medical Clinic. And this young man has been operating, I think, in Marshall County probably for 26 years.
I appreciate that, George, but I appreciate you saying I'm young. but it's been closer to 30 years. So,
all right.
So a little over 30 years, actually. And I'm proud to be here on Martin Luther King's birthday.
And I want to say I thought it was a little bit more than that. But I want to say something that's fitting, this being Dr. King's birthday. And Dr. Williams, he's the owner, I think I'm correct here this time, is saying that he's the owner of the only black hospital in the state of Mississippi. Dr. Williams.
Yeah, actually the owner of the only privately held minority hospital in the whole country.
Oh, in the whole country.
Not just Mississippi. So,
okay.
Proud of that fact.
Tell us a little something, if you want to speak just briefly.
Well, again, glad to be here on Martin Luther King's birthday. As you know, the COVID vaccine is available, and the reason that we're here is to try to encourage our people to come out and take the vaccine and get some knowledge of reasons why they should take it. And I certainly hope that we are able to convince our community to do that today.
Okay, thank you so much, Doctor. You know, there are so many questions about COVID, and you know, I may ask some questions to you today, and it might sound foolish because I'm a layperson, but you can kind of set the record straight. And I also I certainly don't want to put you all on the spot, because I'm quite aware that this COVID thing is something that they're learning new things about practically every week, a month. So, you know, we won't hold you to anything. We can only share with us and the community what information, knowledge that, you know, you have. You know, one question that a lot of people ask, you may can put, you know, dismiss it in up front, or either give your opinion. A question has been asked: is this a man-made virus, or is this was it possibly created in the laboratory, or is this a natural virus?
Well, of course, we all want to know that answer. They haven't determined or not. The World Health Organization certainly is doing research to see where it was created. The first place that they noted it was in was, you all probably have heard of Wuhan, China. Mm-hmm. They don't know if it originated in Wuhan, China, but that was the first community that it was very infective of in that area. So somewhere in that area, they're not sure if it was man-made, or some people have suggested that the virus actually came from bats and somehow went over into the human race. But the World Health Organization is still trying to figure this out, and I don't know if we'll ever get an answer to that. Certainly, speculation is that it was created by man in a lab, but we do not have that answer.
Don't have the answer. Right. Is it safe to say that this virus basically attacks through your respiratory system? Is that safe, or are there other ways that it perhaps could enter?
Well, it is certainly primarily respiratory borne, and that is why it's been so negligent on our government officials for the longest to not tell people to wear masks, because this is the number one way that it is transmitted. Mm-hmm. They have suggested that it can be transmitted by other means, whether, they used to tell you to clean all of your environments, hand to mouth, whatever, but they do know for sure that it is primarily a respiratory illness.
Mm-hmm. And once it enters the body, it appears to affect all of the major functions and arteries of the body.
Yeah, well, everyone is different, and certainly the lungs are the number one thing that you have to worry about the most. Mm-hmm. Respiratory illness, pneumonia, bronchitis, and those are the majority of the patients that get really sick from it that we've had to admit to the hospital. The other things, there are blood-borne problems that can occur, such as blood clots. For some reason, it's been found to cause clotting in the blood system. So some people have had blood clots that have been detrimental as well. But we do have to keep an eye on of course, blood affects every part of the body, so you do have to keep an eye on your kidney function, your liver function, mm-hmm. As well. So certainly it can affect any organ in the body, but the respiratory lung system is without a doubt number one.
Mm-hmm. Yeah. Is there, has it been determined that some people may have a natural immunity? Is there anything to that, or is it that you know of?
Well, there's no such thing as natural immunity to it. There are some people that have gotten the infection and didn't have any symptoms, and they developed immunity to it, but they had no idea that they had the virus in the past. So that does happen.
So that could explain how maybe two people in a household, and one could be stricken with it, and another never have it.
It is a strange virus. You can have some people that just go down, get very ill, and you can have some that have no idea that they've had it at all. It is very much a strange, and you don't know how it's going to react to any one person. That's why it's so important to make sure that you get the vaccine, because you don't know how it's going to affect you.
Right. It almost sounds like there's some form of immunity in a way. I mean,
well, they've speculated that people that have certain blood types have an immunity. And you probably heard people that have O positive blood, they tend to do better with it. We don't, but they don't know that for sure. Okay. But immunity in itself means that you cannot get infected from it, okay? Mm-hmm. That your body has an automatic response when it sees the virus. Now, that's when they say you got immune, that's what they're talking about. And the only way you can get immune to something is you've been infected with it in the past. Mm-hmm. So that's the only way that you can be immune from it.
Yeah, I would like for you to explain something else too, to the listening audience. A lot of people vaccines. If you could kind of give the basis of how vaccines are created or established, and what I'm getting at, there has been rumors that don't know, but you can set it straight that whatever that's used in the vaccines now to treat the COVID, that it's not a natural agent of the body. Now I might be saying this wrong,
Right.
But if you, like in most flus, they use a small quantity of it and they insert it into the body and to make the body react to it in a way to defend against it. And then the body is prepared when they recognize it again. So a question is what these vaccines are made of? Is it a natural agent or is this something laboratorily created?
Well, let me go back in time a little bit. Vaccines originally started years ago, if you remember polio virus,
Right.
going back in years. And at that time, they would actually get the virus. And let's just take a football player. He's a great player, but man, I injured his leg. Mm-hmm. So they would actually injure the leg and insert live virus in the body, knowing that it couldn't score a touchdown on you. Okay, it might get 10 or 15 yards, but it couldn't score a touchdown. So that's what they would do to a live virus that they put in your body. Well, and then your body would mount a response to get rid of it, to take it off the field. Mm-hmm. Well, then they came up with the process of with the flu virus of giving you dead virus. In other words, they had the virus, but they took certain parts of it where it's not running, it's dead, and then they put that in your body, okay? And your body developed an immune response to it and got it out the field. So that's I'm trying to make it well, it's simple. Well, the difference with this one it's not just live or dead virus. They took some of the DNA, the things that make you, the DNA that makes us who we are. Mm-hmm. They taken a sample of the DNA and actually created the virus, the immune response to the DNA of the virus. Mm-hmm. Now, a virus is simply an organism that cannot live unless it's in a living cell. Okay, different from bacteria. That's why viruses have to be in a living organism to grow and to spread. Otherwise, it dies. Okay, so once it gets in the body, and you got the DNA, and your immune system recognizes that DNA, even though the virus may not be there, your body, hey, this organism is here. So your body's immune system is attacking that organism and getting rid of it. So you're building what we call an immune response. So if that virus ever enters your body, your immune system automatically takes it and takes it off the field, and that's how it works.
That's interesting, and I truly hope that some people will kind of get a better understanding, get an understanding of what you're saying, and the reason I'm asking that question is because and I know there are all manner of rumors that's floating, on the internet and Facebook and everywhere about some type of agent that into vaccines that's not conducive to certain people. Rumors like it making people appearance change. I've even heard that. I don't know if you all have. I've even heard rumors like well, let me give you one kind of crazy one. I know you probably heard it too, that it gave them HIV, this kind of thing. These are the things that we got to address. And then I have a printout on vaccines that's given.
Right.
And I'll share that in just a few minutes, and it shows how many whites have taken it, and then how many blacks.
Right.
Now, and it's scary when you look at that. I mean, it's kind of like the very people that need it the most are the people, for some reason or other, is scared away from it, and that's really basically what we're here for. We here hoping that we can ease some of the tension and concern. So if you would, just kind of feel free and just kind of talk about that.
Well, I did want to, when I talked earlier about the virus, and I'm going to let Marketia speak in a minute.
Certainly.
But I do want to say that when they prepare, these different companies prepare the vaccine, they have to preserve it in something, okay? Even when you ate certain foods, you have to preserve it so it'll stay stable until you can use it. And each company uses different preservatives in order for that molecule to stay viable or stay alive. So that's some of the things that people have been reacting to may not necessarily be the virus. It's the preservative that company uses. Now I can tell you, we've given several hundred shots, and if I look different than you, George, please tell me. If Marketia look different, you just let me know. I can stand to look a little bit more handsome. I ain't gonna tell you no tale.
Well, I'm gonna have to take a closer look now, dog.
But we've given several hundred, and we haven't had the worst reaction that we've had was probably someone who had a local reaction on the skin. And then you always gonna get the one or two people that will get lethargic for a couple of days, but we've had no severe reaction. And it's disheartening to me that there is something that can save people's lives, and our people are scared to take it.
Absolutely.
That's bothersome to me, because I will tell you, you just said the difference between white America and black America. Look, if whites are flocking to something, does that not tell you they're not running from it?
No.
They are running to it.
And Doctor, and while we on that too, I'd like to just say this, too. I would hope that when people hear a lot of these different false statements or these mistruths and fake news and all of that stuff, you might want to take a moment and kind of realize where a lot of that comes from. You got a lot of these militia people, these people who overthrow people who's promoting a lot of that. And I'm going to just say this. We was talking about the vaccine a moment ago. It looks like the last thing I looked at, it was 60,172 white that has taken it, and this is Mississippi that I'm speaking of. And it looks like in black people in Mississippi only 14,000 people, 14,158.
And it's not like it's not available. This is not like something that they are keeping from us. This is us not. I almost want to say falling for the okie doke.
Yeah.
And we are not responding to this. Look, I can tell you in our office, we made available. At the hospital, we made it available. Marketia can tell you the majority of the people that are showing up, I'll let her tell you, are not black and brown.
Go ahead.
The majority of the people that are showing up are Caucasian.
Certainly.
True.
Yes, that is true. And they are elated for the opportunity to actually receive the vaccine. They're very grateful. They understand the impact that it'll make on their lives, especially those that has not had the virus yet. So they're excited to actually be able to receive the vaccine. And it's more of our older Caucasian population that has, and they're knowledgeable about it, and they're coming in the door. Which vaccine are we getting, and how many shots? And they're really interested in knowing more about the vaccine, and they understand the importance of it. So yes.
Yeah. That is wonderful. Just before I go any farther, I want to do a thank you, if I could, to Mr. Tim Garrett. He's the owner of the photo and video studio on the square here in Holly Springs. He does a wonderful job of doing videos and photography and all of that good stuff. And we appreciate him covering our efforts here this afternoon to cover something that and I'm sure that Dr. and his staff consider to be one of the major concerns that faces us here in Marshall County, and I'm sure the same thing all across the country, actually. His phone number, you can contact him to get service, 662-271-2470. Again, that's the Mr. T.M. Garrett, that's Photo and Video Studio on the Square in Holly Springs. Let me just I'm going to talk just a little bit about another matter. We know that that the Trump administration, their rollout, it just was inefficient. It just not, and the vaccines, I'm hearing that they're not getting to where they need to be. And I am thankful that that your facility was one site that was actually doing vaccinations. Now they had been rumors around that maybe that you all were going to be short of supply, and you may not be given additional shots. So I'd like for you all, if you could, to just kind of talk about that just a little bit.
Okay. So, yes, no, we're not out of vaccines. We are waiting on a shipment for some more to come in. We are getting low. I think we have maybe 100 vaccines now that's allocated to scheduled individuals next week already. But I spoke with the State Department on last week, probably Friday, and they said we should be receiving more very soon. So I don't think we're going to run out of them. We have already started receiving our second doses as well, and those are allocated. They can't be administered to people getting their first dose. They have to be set aside for second doses. So we're still able to administer the vaccine. Now, we did run out at our clinic, and it's still unsure as if they're going to send us more at the clinic, but we do still have them at the hospital.
Mm-hmm. So is yours the only facility that administering right now? Now, that's important. Now, you believe it or not, I'm in government, and many people have asked me about the vaccine. You would think that the health department is supposed to be responsible for is getting the vaccines out or whatever. But I am here to tell you that you can't get any information. And I'm not the only one saying it, because I know dozens of people that say that they've tried the phone, they've called. The phone is normally busy. And then if you get somebody, they refer you over to Hinds County, and they give you a couple of numbers over there to call. And if you call them and you inquire about that, they're going to give you a website to go to. And that is really disheartening. But your facility, your operation, do you know of anybody else, you say, that's actually doing it?
I don't know in Marshall County. Dr. Williams may have more knowledge of it, but as far as I know, we're the only facility giving them.
Yeah, and that's true. George, we contacted the State Department of Health because, as you know, we don't have a full-time health department in Marshall County.
Absolutely.
So, and I'm not, no knock on them, but we knew that this could be a problem. So we went on site, both at the hospital and at the clinic, and let them know that we wanted the vaccine that we need. So we had to register to get it. Mm-hmm. So there was paperwork that had to be done in order for them to send it to us. And I'll give you an example of, I think it's important to show how governments can work together to make things done. Over in Panola County, where I'm a part owner of the hospital in Panola County, the county actually, when they were getting ready to roll it out, the county board of supervisors stood up and said, "Look, we don't want to work with the health department." Mm-hmm. It's a true story. Mm-hmm. And they said, "Can we work with Panola Hospital?" So they set up the tent, the drive-through, and did everything, and they got the vaccine there. But the only people that have been given it has been the hospitals. We've also been fortunate. I think the only clinic in the whole state that has gotten any, am I correct? It's something like that. Mm-hmm. So we've been fortunate to get what we have, and we are fighting. And George, even today, if you want to read my email, we are fighting to get more for our community. Mm-hmm. So there'll eventually be more stable vaccine that they'll give to other offices and everything. That's coming. But we had to fight to get what we have.
And you know, and you're to be commended for that. I mean, I don't know. I mean, I know you're in the healthcare business, and that's what you do. But you know, I don't know if a lot of people aware of sometimes, you know, the hoops you have to jump through to try to protect your community.
Right.
And I think it's just good, you know, for this opportunity, you know, to kind of get the word out that you know, what you had to go through to try to get it to work out for us.
And that's the reason why we are doing everything that we can to make sure that we follow the phases as they put them out, and we're only giving the vaccines to the people that fit the criteria, because we don't want Marshall County to end up not having vaccines in the area because we're not putting them out appropriately. So that's very important. We're trying to make sure we don't waste any doses. And to this day, we've wasted 2 doses only out of all that we've received. So we're trying to make sure that we get every single dose in somebody in this area.
So you're able to keep them, preserve them. I guess they come in a little vial, little things
Yes.
like you see.
They come in the glass vials.
Yeah, and how many shots
we've been able to get anywhere between 12 and 13 doses, anywhere from 10 to 12 doses per vial. Each vial is a 10 multi-dose vial, but some of the vaccine vials are having maybe 1 or 2, sometimes 3 more doses in them. So, and you have to use them within a time frame. And so once we puncture that vial, all of those vaccines have to be given within a 6-hour period. So to avoid wasting a vial, sometimes at the last moment after someone haven't showed up for a scheduled dose, we'll try and go on and give it to whoever is interested in, you know, having the vaccine, to try and make sure we don't waste any doses.
And another question, I know that all of this has been done by the guidelines that's established by the health department and everything. You know, and that's just to say, you know, some people would say, well, you know, somebody got some kind of a special privilege, you know, and somebody else didn't get it, you know, and that kind of thing. So, yeah, you have a guideline that you actually go by, and that's what you actually,
Yes.
you know, go. Where those the individuals who have had the shot, there's always reserve enough for that second shot. Is that basically right?
Yes. So the way they sent out the initial shots, and then they just sent us last week a 100-dose vial box which is set aside for second doses. So anyone that has received their first dose and wondering if it's going to be enough for the second dose, that's not a worry. They've already, the Mississippi Department of Health has already remedied that situation in the case that someone runs into that. They are sending them out as we put them in the mixed system for your second dose. So they're monitoring what we're giving and who we're giving and who's due for that second shot.
Tell me, from your position as the owner and director of the hospital, and I know that President-elect Biden, he's prepared to do a complete rollout plan. He's talking about, you know, vaccines. He's talking about people coming in and setting up sites. And what would be helpful, doctor, to help you with what you're doing already, or with if he came in and his new plan was distributed all over, whatever, would that be negative to you, or should funding be put into your operation to expand what you already doing? Is what I'm trying to say. What's your thoughts on that?
Well, I mean, in all honesty, I think he has the right idea. He said he want to give 100 million shots in his first 100 days. It doesn't take a blind man to see that's 1 million shots a day. And we got 50 states. That's 20,000 per state. You know, I love mathematics, and that can be done. And whether that be, but I do think that it will be bigger than just what we could do as an organization. They have to involve all, the other physician offices. Everybody has to do their part. We're willing to do everything that we can, but manpower, number one, you have to have the vaccine. Number two, you have to have the manpower. We could put the manpower together, but, would that be fair on one organization to do that? You would much rather that all of the healthcare organizations could contribute to this. I think it's a little bit unfair that the word that has been put out that the vaccine hadn't been rolled out, and they keep saying that the vaccine rollout has been slower than normal. It's almost like, we take that personal. It's like, well, we're doing all we can right now. Give us the vaccine and we'll do more. So don't blame the healthcare organizations for the vaccine rollout being slow when everything is being dictated by the state. And the governor's office are dictating, and of course, I guess it's dictated to them about the amount that they get from the federal government. So somewhere down the line, that ball has not rolled the way that it should have been rolled. I do think it's unfortunate that our president took his mask off after he had the COVID and stood in front of everybody. I think that he has misled our community completely.
Certainly.
About this. It's horrible what he has done to not just black and brown, to white, Asian, Latinos. You don't play with people's lives like this. This is not politics. This is a healthcare issue that was taken to a level that it never should have been taken to.
Absolutely.
So it's unfortunate, but we're here to do what we can. And I do think that our new president at least understands the severity of what this virus can do and is trying to put a plan together to squash it. I think it's important that be done.
Certainly. And I'm like you. The mere fact that the previous administration had no national plan whatsoever. It's just we were just finding our way in the dark. States, everybody was on their own. Do what you can, how you can, So hopefully, we have a few more days, and we'll roll out a plan that some people can get vaccinated. But at the same time, I want to ask you something about. You have let's talk about Trump for a minute. There, I've just referred to him as Trump. They say he had coronavirus. That's what they say. A lot of people don't think he had it. But he was able to take some kind of treatment, some kind of vaccine. And I'm trying, your facility, talk about that for a minute.
Another case of where it's unfortunate that our community doesn't understand what we have here in our little hospital here in Holly Springs. The same thing that the president got, we have. Okay, we have it here. I hear a lot. I had a gentleman come see me in the office just on Friday. He had gotten admitted up the road for 2 days, and quite frankly, he was in the hospital up the road. I'm not calling any other hospitals because it's not for that reason. But he lives in this community, got taken to another hospital, and was in that hospital for 2 days and did not get one medication for the COVID infection, okay? Not one. And so, we have tried to let our community know, not only do we not have it, if you have the infection and not bad enough to be hospitalized, we have the monoclonal antibody that we can give you an outpatient infusion. In Greenville, Mississippi, they are dying. They got people coming from across the state lines to get this medication, and we can't even get our community is so busy thinking that we are behind the curve, don't realize that we are actually ahead of the curve in this little small hospital here. We have Banlivimab, which is the outpatient monoclonal antibody. We have remdesivir. We have a protocol that we got from the large university systems for all of our patients. And it doesn't mean that all of our patients are going to make it. But if we do know how to treat as well as any university any place in this country, right here in Holly Springs, Mississippi. We also are doing the PCR testing, and we have been doing for years things that people think that the university, we're the only little small hospital that has the equipment, now that they run out with these quick, that actually does the testing in-house. And for a long time, I know it for a long time, before the quick testing, that was very important. But you remember when people were waiting 1 week, 2 weeks? Mm-hmm. Well, we actually at one point were getting 24 to 48 hour turnaround, and we still can get 24-hour turnaround. Then there's always some delay if equipment goes down. Mm-hmm. But it's the most accurate piece of equipment that's out there to determine if you have it. As you know, even if you get tested positive on the quick test, you still have to get confirmation, mm-hmm. Especially if you have no symptoms. They still have to send it off to the big labs, which we have, mm-hmm. to confirm that your test was positive.
Yeah.
So just to let you know, we do have the treatment. We've tried to advertise it to the community. Marketia has gone and put it on Facebook. We've done everything that we could to let our community know that the treatment, as the most up-to-date treatment, that the president of the United States, and he got something, and I do believe he had COVID, mm-hmm. but his cocktail that his attorney, Rudy Giuliani, got also, we have it right here.
Is that right?
Yes.
And that's so important. That is so important for people to understand that what you need is right here at home.
Yeah.
Just patronizing your local, hospital and in your medical clinic, and helping someone. We say this is Martin Luther King's birthday. This is a black-owned, minority-owned business right here in struggling, and he talks about. I talk to doc with me. It's like personal. It's good when you have a doctor that you can communicate with on a personal level. And I know I've called doctor many times and asked him to help us out with some things that we were running against the clock getting out, and he took the time, as busy as he is. And also, I have to say, even today, he's working today. You can see him in his scrubs and everything, but he took the time to call here and kind of talk with us some about some things that concern a lot of our people in our community. Somehow, in some way, that we need to get black people, minorities, up and get them in and out. And I don't want to take anything from people who interested. I don't want to do that, because there are a lot of people right now who's prepared and willing to get in line and take the vaccine. But on the other hand, there's a lot of people that is skeptical, nervous, or they're listening at some things, and it's not in the best interest, because they're not stepping up. And I think that to just say 14,000 in the state of Mississippi, that's pitiful. It's just unreal. What are the options? I'm gonna ask. I'm gonna key to that. What are the options? You don't take the test, and or take your chances. What's any thoughts along that line?
From my opinion,
mm-hmm.
I wouldn't take a chance if I had an option to receive something that could prevent me from getting COVID-19. I've seen a lot of people who come in with COVID-19 and they're very sick, and I'm sure if they could have made the choice, do I want to take the COVID vaccine or do I want to take my risk, they would have chose the vaccine. Mm-hmm. So my statement is, don't wait until after you get the vaccine, get infected with COVID-19 and then you want to get it. Go ahead and get it now. Save your body some stress. Save your, if it doesn't work, if you end up getting it after it, then you did all you could to protect you and your children who are not able to get it at this time. But my suggestion is get your COVID vaccine.
Mm-hmm. Yeah, protect. Any thoughts along that line, Doctor?
Oh, absolutely. We have the tendency, and I know, I hope you, let me make this statement, George. You said something earlier about race, black-owned hospital. You know, people that know me know that I'm black. I'm proud to be black, but I don't see color. You know, when people come to my office or they come to the hospital, it's all about people. When they come in to see you, color doesn't come to the surface. You know, all of us got red blood. And so I'm proud to have a black-owned organization that is run to treat people like people and not like a number. And that's what we try to do, okay? Mm-hmm. So I'm proud to sit here today and you ask me about this program and try to encourage. And this program is primarily aimed at us, black and brown folks, coming out, quit listening to the street committee, get off your butt and come get the vaccine. That's what you're saying. I mean, that's just as straight as I can say it. And it doesn't make sense for the street committee to tell you how to treat yourself. The street committee will get you killed and dead. You need to come on in and get the vaccine and take a chance at life. This vaccine has not killed anyone in the United States. Now, there have been some folks that got sick. Really, it hadn't been a bunch. But I can tell you that we haven't had anyone that has died that we know of. And certainly we've given out hundreds of shots. There's been nobody reported in the state of Mississippi. You say it was 14,000 minorities that got it. Not one person in the state of Mississippi has died from this vaccine, okay, or reportedly. So that being said, quit listening to the street committee. I can tell you there are a lot of folks that have died in this country from the vaccine. It just makes sense. If you got zero over here and getting deaths over here, which would you choose? The vaccine.
Right.
Don't make
many have died from the
virus, right?
Okay.
If there have been I think it's been 100 million cases across the world, okay, and I believe it's close to 2 million have died. That tells me about 2 out of every 100 folks that get it gonna die. That mathematics are easy, okay. So if you take a 2 or 3% chance of dying from not taking the vaccine, then you just keep doing that. I want to take my chance of not dying, and I've taken mine.
In a case, doctor, I was calling that first shot a booster, but I got it reversed. Booster is the last one.
Yes.
And after you take that first shot, and a person attracts COVID in between the time they take the second one, is it still suggested that second shot be taken?
Yes. Yes. And you can still get COVID. As you know, when you take that first vaccine, you're not going to get an immediate immune response. You'll get some. It takes about 2 weeks before you get a good response, and that good response is not a great response. You don't get the great response till after the second, the booster shot, okay? But you still, even if you got the virus in between that time, you still got some immunity that will hopefully make your symptoms a lot less, okay? And that is because you got some immunity that's working, not enough to get rid of the virus, but enough to maybe put it on the sideline. Okay.
So what you're saying, if I'm understanding correctly, you could attract it.
Yes.
In between that.
Yes,
and
absolutely.
But to follow through, get the second one, and it's a good possibility it may wipe it out.
Yes, you definitely should take the second shot, even if you contract. And it has happened. One of our workers at the hospital, she took the vaccine. Her husband had the illness, came home, and she ended up getting it before she had enough vaccine, enough immune response in her body. Okay. But fortunately, her symptoms hadn't been horrible, okay? So you can definitely get it, there's a timeline to it. But that immunity really will be about 2 weeks after the booster shot. And as you know, the data is it's only 95 to 96% effective. So there's a 4% that are not going to respond even to the vaccine and the booster. But that's still low, So, So the vaccine is not going to work for everybody. You got patients that are immunocompromised. In other words, their immune system doesn't naturally work. They take medication to keep their immune system from working. So there's some people that are not going to respond even if you give them the vaccine.
I had someone that had texted me here, a friend of mine. He said, well, what qualifies as a pre-existing condition under the criteria?
Okay, and I guess that's what I was just talking about, the immunocompromised patients. That certain patients that have certain illness like lupus, those are viral illness, and those are autoimmune illnesses that your immune system doesn't work quite the way that it would in a normal person. Because lupus is a case where your antibodies are attacking certain organs in the body. So anybody that has an immune-related disease, we call those immunocompromised. People that have cancer that have been on medication to make changes in their body, and they could have chemotherapy that can cause them to be what we call immunocompromised. In other words, their immune system doesn't work like it should normally. Those are the ones that you have to that you are leery about with the vaccine and whether or not it's going to work properly. Go ahead, you got it.
And just to give you a specific list of the medical conditions that qualifies you for that vaccine, it is cancer, chronic kidney disease, COPD, which is chronic obstructive pulmonary disease, Down syndrome, heart conditions such as heart failure, coronary artery disease, cardiomyopathies, immunocompromised from organ transplant, obesity, severe obesity, pregnancy, sickle cell disease, smoking, diabetes, or other medical conditions determined by your medical provider. And that's for the age group of 16 to 64 with underlying medical conditions.
Hey, someone had asked a question about transplant patients.
She just
hit that. I'm sorry. I'm reading that and didn't see it.
Yeah.
And what was that on the transplant patient?
Yes, if they are a organ transplant patient, they qualify for the vaccine.
Oh, okay.
Yes.
Okay. Great. Okay. Listen, what I would like to do is I'd like to take a few minutes here and I just want to. I want to just kind of brainstorm just a little bit, and I want to, as a last-ditch effort, to just try to reach out and touch some people. If you have a question, we got just a few more minutes here. See if you can hit this station, 252-6692, and we'll try to get your question in right quick as we can before our time completely runs up. But at the meantime, I'd like for my panel here, because our number one objective here this afternoon is try to ease some tension for some people who, for some reason, is still straddling the fence. And I know some people. I know personally some people who are nervous about it. Is there, anything that you could say as medical professionals that could kind of help a person go head on and make that decision? We pretty much talked about the fact that your ears are not going to fall off and that kind of thing. But that just kind of appeal to some people who are nervous.
Well, if you don't want to go into the CDC and read all of the information that they have on the vaccines, and you just want someone to tell you, my suggestion usually is what I tell people: you don't know how you're going to respond to the COVID-19 virus. So why would you be so afraid to take the vaccine when you're saying you don't know what that's going to do, and if it's going to have chips in it, and all these rumors that people are saying and talking about? If you don't know what it's going to do for the virus, you don't know what the vaccine is going to do. You don't know what the virus will do to you either. So take the risk of preventing your body from being exposed to that virus. She said you have a call.
And I'd like to say, if if people will consider this like a treatment, even though it's a preventative treatment, that's what vaccines are. It's really a treatment to try to help you from getting that illness. If you look at it like that, I heard someone mention, well, just like the Tuskegee folks with the syphilis trial, and I'm saying, well, that means if y'all know your facts, they gave them syphilis and didn't treat them. It's a difference here. Mm-hmm. We got the treatment, just take it. Yeah. So this is completely different than them giving you something to try to make you sick. This is, they withheld treatment for those folks at Tuskegee. They are actually giving you the treatment here. So the mindset just needs to change and come on and get it.
Certainly. I think we have a caller. Go ahead, caller.
Yes, I was calling. Wanted to know, do y'all have a specific date set for your vaccination?
Yes, so we give vaccines. We actually do drive-thrus at the hospital, and we were doing them on Monday, Wednesday, and Friday 3 times a day. And so it really depends on the amount of vaccines that we have, and being that we still have the 100, we'll probably go ahead and push those out as soon as possible because we've gotten so many calls. We were trying to make sure we got all of our 75-year-olds and older and healthcare personnel, but now that the phase has been is open to the 16 to 65, we will go ahead and start that vaccination process for everyone that qualifies. And so those 100 probably will go pretty fast, but that doesn't mean not to call and put your name on the list, because as we continue to receive the vaccinations, we will call and schedule you for your vaccine.
So what you're saying is, excuse me, you need to call and put your name on the list before you come?
Yes, if you could call the hospital 662-252-1212, or call the clinic 662-252-1599. They'll put your name on the list and call you as we get vaccine available. And George, I do want to end this on a positive note. We sit here and talk about folks not wanting to take the vaccine. Well, we have over 1,500 people on the list already. We just waiting on the vaccine so we can call them in. So they have been calling, and we have a group that have been wanting to take it.
Great. Oh, that is wonderful. Did we have another caller? Okay. Thank you so much for that information. And I tell you what, I think that was important. I think that's certainly something, probably answering that question, you probably answered about at least 50 with that question, with that answer right there about, yes, you still sit up. And I believe we have one other caller coming. So if you could, come on, caller.
Good afternoon, Brother Zinn, you and Dr. Williams.
Good afternoon.
This is Pastor Todd calling. I just been sitting here listening at you all, and I just have a question. I've been listening at you all. Something just came across my mind. Since a lot of us, we don't quite understand about the vaccination, I was just wondering, would it be better if, it could be a meeting for the people to come and maybe explain it better than what we've been hearing? I've been hearing things too, and I'm a prayer warrior too, and I'm sure we all are praying, but I'm just wondering, would it be better if we set up somewhere we can come and hear what you all are saying? And, I know you're doing a great job what you're doing, but sometimes I think it's better if we come in a setting. It's just my thoughts, okay?
Anybody want to answer that?
Pastor, I will say this. We are available and ready to assist anyone or anywhere possible. I'm thankful that Mr. Zinn, George, Supervisor Zinn came to me to ask me to be a part of this because he felt the need in the community. And hopefully this is just a start, and hopefully more things can happen just as you asked about.
Yes, sir. Okay. It was just something I was just wondering, about, that's all. I'm just, I'm planning on getting it. I'm going to let God lead me. But that's just something, like a thought came to me. I don't know whether it would help anybody. Maybe someone else maybe done thought the same thing. But it just came to me. That's it. And I thank y'all for what y'all are doing. Y'all have a blessed day.
Thank you.
Okay. Thank you so much. And I guess we're pretty close to the time where we need to be dealing out some serious thank yous. I spoke with Marketia early this morning, and she was kind of pulling her hair out. I know she don't want to go into that right now, but I'm glad she didn't pull it all out. Also, thank Dr. Williams for taking a little time off his busy schedule to come and try to sit down and talk with us. I would like to encourage, though, those who have some questions or some things that they're still not quite familiar with, do just a little bit of research on this, and don't rely so much on Facebook and the media. Just try to stay away from that and just try to get some good, solid info. It'll help you a lot, and it'll help your family and anybody else who you'll be able to then to share some information about this with them that would be solid, the concrete, that they would feel comfortable, at least coming from a family member or something. Wanted to thank Mr. T.M. Garrett for doing this video for us this afternoon. Remember him? He's the photo video studio on the square here in Holly Springs. He's doing a wonderful job. You can contact him at 662-671-2470. And he's glad to do business with you and help you. We thank him again for just donating his time to do this video. And then hopefully we'll have it recorded, and those who may have missed this session, they'll be able to see it at a later time. Thank everybody for tuning in. And remember this, I'd like to do a quick shout out, if I could, for a young lady who, her husband, Charles, Delia Reed, and Vonda, who operates our food pantry, or Feeding Heart Food Pantry over Victoria. They work day and night, and I tell you, it's unreal, the kind of work and the kind of service that's provided to people in need in the various communities. Thank you. Go out to them, and thanks again to all the listeners. Thank Ms. Boeing, and thank Dr. Williams. At this time, I'm going to sign off.
Thank you.
Thank you.